Causes, symptoms, and risk factors of miscarriages. Causes. The majority of miscarriages are believed to be caused by genetic problem in the embryo that would prevent a baby from developing normally and surviving. These fatal genetic errors typically are not related to genetic problem in the mother. In other cases, certain illnesses or medical conditions can cause miscarriage and may increase the risk of miscarriage. Mothers who have diabetes and thyroid disease are at increased risk of miscarriage. Infections that can spread to the placenta, including some viral infections, can also increase the risk of miscarriage. In general, risk factors for miscarriage include the followings: older maternal age, cigarette smoking, moderate to high alcohol consumption, trauma to the uterus, radiation exposure, previous miscarriage, maternal weight extremes, anatomical abnormalities of the uterus, use of non-steroidal anti-inflammatory drugs around the time of conception may increase the risk of miscarriage. Women who had one miscarriage have an incidence of miscarriage of about 20%, whereas women who have 3 or more consecutive miscarriages may have a risk as high as 43%. Symptoms. Symptoms of a miscarriage include vaginal bleeding that may be light or heavy, constant or irregular. Although bleeding is often the first sign of a miscarriage, first trimester bleeding may also occur with normal pregnancy. But bleeding with pain is a sign that miscarriage is more likely. You may have pelvic cramps, belly pain, or a persistent dull ache in your lower back. Pain may start a few hours to several days after bleeding has begun. Blood clots or grayish tissues passing from the vagina. It is not always easy to tell whether a miscarriage is taking place. A miscarriage often does not occur as a single event but as a chain of events over several days. One woman's physical experience of a miscarriage can be very different from another woman's experience. Risk factors of miscarriages. Things that may increase your risk of miscarriage include your age, especially at age 35 and older, a history of recurrent miscarriages, 3 or more, polycystic ovary syndrome, which can cause ovulation problems, obesity, increased male hormones levels, and an increased risk of diabetes. Certain bacterial or viral infections during pregnancy. A blood clotting disorder such as antiphospholipid antibody syndrome, problems with the structure of the uterus such as a T-shaped uterus, exposure to dangerous chemical or certain medicines, the father's age, especially beyond age 35, alcohol use, cigarette smoking, or cocaine use during pregnancy, having heavy caffeine use during pregnancy. It is normal to wonder whether you did something to cause your miscarriage. It may help to know that most miscarriages happen because the fertilized egg in the uterus does not develop normally, not because of something you did. A miscarriage is not caused by stress, exercise, or sex. Thank you very much for watching this video. If you like this video, do click on the like button, share this video on Facebook, Twitter, and WhatsApp, and don't forget to subscribe our channel. Thank you. For more information or prognosis of miscarriage, watch next part.